Hi, I'm Anthony Originello, CEO of the Chartered Professionals in Human Resources for BC and Yukon. We represent more than 8,000 members, and as the organization dedicated to advancing the HR profession through education, advocacy, awareness, professional development, as well as our recognized and impactful CPHR designation, we are proud to be a sponsor of this show. We have been the voice of the HR profession since 1942. Learn more about us at cphrbc.ca.
In this edition of Careers That Matter, I'm joined by Dr. Stuart Turvey of BC Children's Hospital and UBC's Faculty of Medicine. Stuart, welcome.
Welcome, thank you.
What exactly is your job?
I'm what you would call a clinician scientist, I think, but really at my heart, I'm a pediatrician. So
Okay.
at my heart, I care about children, and I spend about 25% of my time seeing kids at BC Children's Hospital in the clinics, and then about 75% of my time running a research program, really trying to understand the child health challenges through the research lens.
We're not talking about a doctor's visit, where like when you're spending 25% of your time going, okay, the child's going to come in, I see them, here's a prescription, go home.
No.
They're in the hospital, right?
Yeah.
So what does that interaction
Yeah.
look like?
So I'm a pediatric immunologist, so it's a narrow pediatric subspecialty. We look after children who are born with weak immune systems. We might be familiar with the bubble boy that we talk about. And so those children are in our hospital, and we look after them in terms of making the diagnosis, working through treatment plans that often include quite dramatic things like bone marrow transplant to replace their immune system. So it's immensely fulfilling because we start with scared parents and small sick children, and almost always can end at the other end with healthy kids and happy parents.
So it's a fairly close and intense relationship that you have with the child and with their parents.
Yeah, and that's what I think we love. And there's a small group of us, a handful of clinical immunologists in British Columbia, and I think, know all the children in BC who are living with these severe immune system disorders, and love to celebrate their milestones.
So let's talk about the lab and research side of your work. What does that look like?
Yeah, so I have a team of maybe 15 or 20 people in the lab who really do the work. They would laugh and say, I sit at the computer and drink coffee. And
tell them what to do.
Well,
I say that facetiously.
Yes, I hope that they actually, mostly I think it's just encouraging their great ideas.
Yeah.
But we, for example, will find a genetic change in a child that might be the cause of their disease, but we have to work that up. And so at the bench, we'll be engineering the child's genetic change and entering that into the cells and measuring how the cells respond. We're fortunate that we're able to, if the families are willing, have blood samples from the child and others, and we can measure the immune system there. So we're marrying work at the bench and then also larger scale computational or bioinformatic work to really find those genetic changes and measure the immune system at a global level.
So this lab is your responsibility then?
Mm-hmm. Yes.
Is part of that raising the money to make sure that you can continue to run the lab?
Yes, absolutely. So, I'm fortunate to be based at BC Children's Hospital and be a UBC professor where we, for example, my salary is supported and we have physical space, but it falls on me then to work hard to raise money to, for example, pay salaries for the people that work there, or pay for the reagents and materials that we use to do those experiments. So, it's a partnership. I couldn't do it alone.
So does that mean that for the most part you're working on putting together applications for grants, or are you actually having to go out and recruit donors as well?
It's a little bit of both. So we absolutely have a strong track record of competing for external grants from the Canadian federal government and other agencies, and is real work that goes on all the time. At BC Children's Hospital, we have a fantastic foundation who have reputation across the province of being such fantastic stewards. And so I do work with the BC Children's Hospital Foundation around philanthropic opportunities as well. So it happens because of the philanthropic support that really we leverage that to go and compete effectively for the federal government dollars or provincial government dollars.
It's still a part of your job, though. And so it takes time.
But I love that part, to be honest. I think an important part of my job is to be able to communicate why science matters and why having research devoted to child health really transforms the lives of children. So I'm passionate about that.
Well, that communication part is another part of it. Yes, there's communicating to people who might give you some money, but you're also then communicating with the world at large. Mm-hmm. You're here right now doing an interview. So that's another part of your responsibility.
And it's a little ironic. People might think, if you want my job, we've got to do really well in math or get high scores in the MCAT and those things, and maybe shy away more from the humanities and social science components. My advice would be that we have to balance both.
Right.
It's great to be good at math or physics or chemistry, but we've got to be able to communicate those discoveries as well.
So let's go back to the beginning of your career. Okay. You graduate from high school, I imagine in Australia, because yes. I sense an Australian accent. Yeah. Did you go, I know what I want to do. I want to be heading up immunology. When you left high school, what was your objective?
I was not very sophisticated when I was in high school compared to kids now. I went to a boarding school in Sydney, Australia, and I was good at school and thought I wanted to do science or medicine. In those days, we went straight into medical school out of high school, and the way you got selected was doing well in the exams. There was no interviews, no letters, no nothing. And so my path into medical school was that way. And it's a 6-year graduate course, and to be honest, after 3 years, I got kind of sick of it. I was frustrated by, I think, the very large lecture halls where they just sort of told me the facts. This is how things happen. And so I had an opportunity to take a year off from medical school and do some basic research. Looking back, was fairly simple, but really had me excited about looking under the hood, I guess, and really understanding how cells work, what's the biology of the human body. And so that's how I started with research. And then there's just been a lot of, I think, good fortune probably and good mentors that got me to this point since then.
So you graduate from school. Where was your first job? Or did you go, okay, I've graduated from here in Sydney, Australia, but I want to do postdoc?
I actually, towards the end of medical school, I was fortunate to get a Rhodes Scholarship. So I basically did my last medical exam in Australia and got on a plane and went to the UK and did a PhD in immunology in the UK. And then I had these 2 degrees, neither of which I'd really used. One was the medical degree that was there. One was the PhD in immunology. And then I saw that in pediatrics, and particularly pediatric immunology, was an opportunity to, I think, unite those 2 passions. And so I did that in Boston.
Boston?
Yeah.
Of all places. They've got a few hospitals around there that are world leading. Which hospital were you at?
I was at Boston Children's Hospital, so the Harvard Teaching Hospital. I did my general pediatrics training, so pediatric residency, and then did subspecialty training as a pediatric. We did allergy, immunology, and rheumatology all kind of mixed together. They're all immune system problems.
So what happened that we were so fortunate to be able to attract you to BC Children's Hospital?
Well, there's 2 answers to that. The glib answer is that I have a Canadian wife, and
Very important.
It's important
Yes.
to maintain, and we are happily married now.
Yeah, and love is a powerful motivator.
The more, sophisticated answer is that I was drawn to the opportunities at BC Children's Hospital, at UBC, and in British Columbia, in that the hospital is a fantastic hospital that serves the province, and so there's very world-class clinical care, including large numbers of complex patients. That was appealing to me. And then the ability to be an academic and a professor as part of the University of British Columbia, which is also a world-class institution, was what drew us here. And it's been great since. I haven't left, and I'm delighted that I've stayed and built what we do here.
Well, and you're doing world-leading work here.
Yes.
And so British Columbia gets to benefit from that. And if you take a look at it, what do you think has been the personal benefit for you to say, okay, I'm going to turn my back on what on the surface looks like a very prestigious career in Boston.
Yeah.
That is kind of the epicenter of so much of this. What have you realized by being here that you go, this is even better?
I really like, I think, the autonomy and trust I was able to have here more quickly than I would have had at, any larger institution, which has just a bigger structure. We are, I think, flatter and somewhat more nimble. So I felt incredibly well supported to go out and do the work we did. And that's what attracted me and still attracts me. I think we have a can-do attitude that allows us to be nimble and do some of the best work in the world.
What do you think, what have you discovered about yourself that you go, this is a component of my makeup from a personality and values perspective that I didn't quite realize that I have, but it's been vitally important to the success that I've had in my career?
I think for me it ties back very directly to the patient care, and so it's the most exciting part of my job would be to be confronted by a family where we couldn't work out what they had using the best clinically approved tools. But with them trusting us and consenting to partner in the research program, then being able to make a discovery, understand the cause of their disease, sometimes be able to treat and even cure that. That circle is immensely gratifying. And from an academic perspective, sharing those experiences through the international literature, we then quickly find that there's many other children with this very same disease that now can be discovered in those others. So I sort of see it as local impact, but global reverberation.
Oh, isn't that amazing? So let's say there's a second or third year medical student who is looking at this going, I hadn't thought of going the path that you did. Mm-hmm. What would you say to them is an important characteristic that they should keep in mind if they want to have success like you have going down this path?
Yeah, I think maybe it's being a little frustrated with status quo and a little curious. I think
a little stubbornness at
times. The frustrated with status quo is not always a great trait because it can potentially cause conflict. But I think just being, for me, it's this commitment to the patient journey, to be frank. And most of our patients can be cared for with the knowledge we have. But we know, for example, in any children's hospital, about 1 in 3 kids are there with some sort of rare disease that we just don't really know what it is. And so it's this dissatisfaction that the family's not going to get an answer, and wanting to push towards that answer, I think is what keeps me going each day, and
Well,
makes it really fun too.
Yeah, well, I see the smile on your face when you say, yeah, that's what motivates me. Well, thank you for sharing insights into your current job and the path that you took to get there.
Thank you.